Assalamu alaikum and welcome to the first episode of our program Career Guidance. In this program we will be talking about different careers. The format of the program is such that in each episode we'll be choosing one particular career and would give you information about it. The field that we have chosen today is medicine, and our esteemed guest of today is Mr. Faisal Siddiqui. Assalamu alaikum, Dr. Sahab.
Awesome.
Welcome to the show.
Thank you for inviting me.
So would you like to tell us something about your qualification and experience?
Yeah, sure. I basically did my MBBS from Dow Medical College back in 1998.
Very good.
After that, I started my residency training in general surgery at Liaqat National Hospital. And that completed around 2006. And then I took the fellowship exam, did my senior registrarship at the same institute in general surgery, and then I'm now working as a consultant in general surgery at Liaqat National Hospital.
Dr. Saab, the very first question that I want to ask you is about the aptitude of people, because I'm sure many young people are going to watch this program. That is it that you have to have a particular aptitude to go for it, or anybody who's simply a hard worker can go for MBBS?
Well, Zara, contrary to the popular belief, this is not the case. To get into medicine and to excel at it, you need to love it.
All right.
You need to have the passion to do medicine. Otherwise, it's a lot of hard work and it takes a lot of time and, you know, aapka khoon pasina.
Exactly.
That is what it requires, and total dedication. So if someone is not in love with the profession, or if someone is not passionate about it, then it is advisable that they stay away from it.
Okay, all right. And this is probably the reason why everybody wants to become doctor, but there are very few people who end up becoming one. Probably. Right. And Dr. Saab, how come that most of the girls want to become doctors, and when we talk about guys, they normally want to go for engineering? Why is it?
Well, I guess that's a very funny thing about medicine. The thing is that because basically the male population, I think they are the ones who need to support their families, and they want to, you know, make money faster and earlier than most people. Now, medicine is a long career path. First you do the MBBS, then your specialization, and then you do your training further, and then finally you start earning money, which is like 8-10 years. Now, on the other hand, if you do some kind of a MBA or something like that, nothing against it, obviously, but if you do something like that gets you into the market earlier, and you get good money for it as well.
So, Dr. Saab, are you trying to say that those people who are seeking good money out of their career, MBBS is not their thing?
MBBS is for people. Then again, we go back to the passion thing, because money comes later.
It does, but a little later.
It does, and when it comes, and if you're good at what you do, you make a lot of money. But you shouldn't go into it for money.
Okay. And Doctor, there is one belief, I don't know if it really is the case or it's merely a myth, that doing MBBS requires lot of rote learning. आप जितना रट सकते हैं उतने ही ज़्यादा marks you get. Is it so?
Well, it might have been true, you know, a decade earlier, but now that is definitely not the case, because the examination itself has changed a lot, and now they have multiple choice questions, they have best choice questions, and choose one best questions. So these questions require a thorough understanding of the subject matter and reading. So rote is on its way out. In fact, it is out.
All right. So merely rote learning wouldn't do?
No, never.
All right.
Unless they understand what they're doing.
All right. Doctor, talking about the changes that have come, you have mentioned some, and one of them is the aptitude test. Are you for it?
Well, yes. I would say yes, I am.
All right. But then there is one belief that the people who are actually against it say that it actually refutes the whole system. I mean, you question the credibility of the 12 years of education, isn't it?
Well, that is a kind of a negative way of looking at it.
Okay.
You see, it is a very tough competition out there.
Okay.
It is, people are very competent. People are coming from abroad. People are coming from different cities to study in big colleges, and they have a lot of similar aptitude people which they have to decide upon कि इसको लेना है, इसको नहीं लेना है, दोनों का इंटर के मार्क्स एक हैं, and it's a very difficult job for them. So I think the aptitude test just helps them to filter people better.
All right.
That is why.
And Dr. Saab, suppose there is somebody who has got very good marks in intermediate, but the person doesn't clear the aptitude test. Don't you think it's in a way unfair with the person?
Well, if somebody has got very good marks in the intermediate and he fails the aptitude test, then that itself is a big question.
Okay.
Okay, because if someone who's getting very good marks in the intermediate should not have any problems passing the aptitude test because it is compatible with what they have learned.
All right, but Dr. Saab, as per my knowledge, aptitude test also includes some questions related to current affairs, if I'm not wrong. It includes general knowledge, current affairs, English, everything. And normally the students who are actually doing their pre-medical are so engrossed in their studies that they say that where do they have time to go for other things?
Well, as far as my knowledge goes in matter of these exams, I don't think general affairs, current affairs is much of a part.
Okay.
And even if it is, it is for evaluatory purposes. It is not something that really marks them or fails them.
All right. And Dr. Sir, does it have good scope in Pakistan, especially for boys?
In the current scenario, to be very honest with people who are watching this show, I don't think that it is a profession that gives you money easily. It is a long way, and it is financially lucrative after a significant period of time, but it is not something that gives you easy money.
All right. And Dr. Sir, were you never tempted to go abroad after you finished your studies?
Well, yeah, that's a long story. But yes, I was, and in fact, I have taken the US medical licensing exam as well as the PLAB for the UK.
Okay.
But unfortunately, or I would rather in retrospect say fortunately, when I took the US MLEs back in 2000, then 9/11 happened, so I didn't go. And when I took the PLAB, then they changed the policies over there. So at UK, so I ended up being in Pakistan all along, and I have no regrets about it because I was doing what I love to do.
All right. So it is in a way a blessing in disguise. Had it not happened, you wouldn't have been in Pakistan.
Yes, well, God has His ways of doing things.
All right. Okay, Dr. Saab, in the end, your message for young people, especially the people who want to become doctors?
Well, anybody who wants to become a doctor should really love their profession. Otherwise, my advice would be not to enter into this profession, because this requires love, passion, and a lot of care for your passion. Because if you lose your passion in between, then things won't work out for you.
All right. Dr. Saab, thank you very much for taking time out for us from your busy schedule.
You're welcome.
Thanks a lot. Thank you very much. That's the end of our show. If you need to give some feedback or you want to know something more about our other careers, please feel free to write to us to our email address. Thank you very much.